Hello everybody, I'm Dr. Samant. I'm a consulting physician in medicine. Today I would like to talk to you about blood pressure or hypertension. Now everybody would like to have normal blood pressure or a healthy blood pressure. First, I would like to tell you what is this blood pressure and why is it important. Now blood pressure means when a heart pumps blood, it gives some pressure to the vessel walls. Now this produces blood pressure. When the heart pumps, the pressure on the wall is known as the systolic blood pressure. When it relaxes and in between beats, the pressure on the wall, that is known as the diastolic blood pressure. Now, how is blood pressure important? A high blood pressure can lead to a lot of diseases of the heart, kidney, stroke, and also it can lead to disease of the eyes and blindness. Now there are many risk factors which cause this blood pressure. First of all, some are modifiable, others are non-modifiable. Now something like age. As we age, our arteries stiffen and so therefore we have high blood pressure. And also family histories. If someone in your family like mother, father, or brothers are having high blood pressure, there's a chance that you may also get it. Also, sedentary lifestyle. Now, this sedentary lifestyle, when people don't move about or they don't exercise a lot, then their weight increases. That causes obesity. That leads to further complications like a hardening of the arteries and consequently blood pressure. Also, some people take a lot of excess salt. Now, salt and blood pressure are very much interrelated. Increase in salt will lead to increase in blood pressure. Also, there are certain foodstuffs like potassium. If we take less of potassium, the blood pressure in itself increases. So, a diet high in potassium in itself leads to a decrease in blood pressure. So the people who don't take high potassium diets, they may also get some kidney diseases and may suffer from stroke as a result of high blood pressure. Also, processed foods and fatty foods, they have a lot of fat and as well as salt intake is very high in them. So these things should be avoided. Another risk factor which is very important is smoking. So one should try to quit smoking because smoking increases the blood pressure and alcohol consumption should be limited, or rather it should be avoided. Another important thing in today's scenario is the stress management. Some people have a very unhealthy way of responding to stress. That can lead to increase in blood pressure. Now let us see what are the signs and the symptoms of blood pressure. A very important thing is that sometimes blood pressure does not have any sign and symptoms. It is mostly known as a silent killer. Slowly the BP rises and the target organs like kidney, heart, brain, eyes, etc. are involved and suddenly the bomb bursts. However, in some people, if the blood pressure suddenly becomes too high, there can be some symptoms like morning headache, tiredness, nausea, vomiting, blurring of vision, some tingling, buzzing in the ears. So these can be some of the signs and symptoms. Now, what is normal blood pressure? A normal blood pressure will be around 120 by 80. Now, 120 is the systolic blood pressure. As I have said before, systolic is when the heart pumps and the pressure on the vessel wall is known as the systolic blood pressure, and 80 is the diastolic blood pressure. That is when the heart relaxes, the amount of pressure on the vessel wall is the diastolic blood pressure. So the normal blood pressure 120 by 80. When a person has a consistent blood pressure of 140 by 80 and 140 by 90 and it remains so for a long time, that can lead to the target organ damage or the person can suffer from diseases of the heart, kidney, stroke, eyes, etc. So the risk factors which cause hypertension are as follows. One is, to reduce the risk, one should exercise almost daily. By exercise, I mean around 150 minutes of exercise per week is sufficient. That is almost 5 days a week of brisk walking. That can open up the arteries of the heart and lead to decrease in the blood pressure. Another and the most important thing is a healthy diet. Now, there is a DASH diet, that is dietary approach to stop hypertension. This consists of low fat diet, lots of fruits and vegetables, whole grain, and the salt is much less. Approximately 2 grams of salt per day is advisable. Also, one should take foods, as I've told before, with lots of potassium. That in itself decreases the blood pressure. Also, another major thing is smoking. One should quit smoking because smoking hardens the arteries and this results in increasing the blood pressure. Alcohol intake should be avoided. At least it should be taken as less as possible, and it's better if the person who has hypertension may quit it. Also, in order to decrease the risk of hypertension, regular monitoring of hypertension is also important. Now, in this today's lifestyle, one cannot daily go to the clinician and get his blood pressure checked. So it is advisable to check your blood pressure at home at regular intervals. It is said that when a person checks his blood pressure regularly at home, this leads to a proper management of the blood pressure and the medicines can be adjusted according to that. Another thing is abnormal, unhealthy and abnormal response to stress. In today's lifestyle and world, there's a lot of stress, especially in the corporate world. And so this leads to an increase in blood pressure. Now, the response to stress can be mediated by listening to music or meditating. This requires a lot of patience, but it is helpful. Another thing is the adherence to medicines. Now, the people who are on blood pressure medication, they should comply with it. The compliance is needed so that the blood pressure regularly is monitored as well as the medicine is taken, so the blood pressure variability is not there and one has a smooth blood pressure. One's goal should be to make the blood pressure around 120/80, so that as we age and our weight increases, the blood pressure also increases. So if we at the baseline, if we have a low blood pressure, then the increase in blood pressure will not be that much. At last, I would like to suggest that there is nothing more precious than a healthy life and a fit lifestyle. So therefore, I would like to add that keeping our blood pressure in control would lead to less cardiovascular complications, and so everybody should strive to keep his or her blood pressure under control. Thank you.